We analyzed data from 3 decades that was collected prospectively and that has been collected used a population-based method, which is very rare, but it's the gold standard on stroke incidence studies. And with these, we found that during the first 2 decades of analysis, the stroke incidence was declining, yet was declining mostly on the white populations and less in the Black African and the Black Caribbean populations. And in the last 5 years, stroke incidence as a total is rising, and this rise is mainly driven by a rise on incidence in Black African and Black Caribbean populations. This is true for all the subtypes of stroke and for all strokes. So it's mostly seen in ischemic and in intracerebral hemorrhage, because for subarachnoid hemorrhage, as is a rarer disease, then our estimates are not as powerful as for ischemic and intracerebral hemorrhage. However, when we analyze these longitudinally, we found that during the 3 decades, constantly, all the decades, the Black African and Black Caribbean populations have higher strokes, but this gap is actually widening in the last 5 years. And furtherly, we wanted to see within each ethnicity what was the role of socioeconomic status, and we found that within each ethnicity, the people living in most deprived areas were having even higher incidence, with the highest stroke incidence seen in the Black African populations living in the most deprived areas. So this really focus and this really creates like a target population where we need to be addressing the cardiovascular risk factors.